here Paola from the CNN covering the WHO simulation at the beautiful city of Paris. Here we are with Laura from the Family Health International. So Laura, today is World Contraception Day. What do you think about that and the family planning? Why it is important?
Okay, so that's particularly important to our organisation. We started as a contraceptive research project in 1971 and have branched from there as an organisation to become a world leader in HIV prevention strategies. And now branching into all areas, health, child and maternal health, education, and projects focusing particularly on empowering communities to find the gaps in services and bridging those gaps with locally relevant solutions.
Well, a second question I would like to ask you is, where are you developing all these strategies? Which countries are you focusing on?
Okay, so we currently have projects in over 70 countries, but we address all of the 6 WHO regions. I'm particularly interested in this simulation in the Asia group. They seem to have a resolution which we'd really like to work with about empowering communities through education and looking at health finance as well. So it's very interesting to us.
Yeah, it seems really interesting. So good luck with it, and thank you very much.
Thank you.
So here we are now with the Roseanne delegate. How do you think that e-health strategies can help with the inequalities between urban and rural areas?
First, I want to say that for Russian Federation, inequality between urban and rural areas is a main issue. We think that e-health could improve. One of the main problems is the training of the healthcare professional, and also it can help us with the diagnosis and treatment of people who live in rural areas.
And how do you feel that this proposal has been rejected at the Euro-Mediterranean region?
Well, I think some countries, they don't think it was important for them. As for example, Eastern countries like Germany, France, where indeed it is, because they have problems with the rural area. Their aging population are in rural areas, so they must consider of taking into account them. But you are right, our proposal has no success. So.
And how do you feel about that? Well, Russia, how it feels about that, and you are looking for some allies?
Yeah, obviously, we continue fighting for this idea, and obviously we want to look also other allies outside of European region. For example, in Asia, I think it's also the main issue, or in Africa.
Well, thank you and good luck. So, are you looking for other allies at the Asia-Pacific region bloc?
In our group, Japan and New Zealand seems the more concerned about environmental issue and its impact on the health of the community.
So, have you other allies at the Asia-Pacific region?
Japan and New Zealand seems the more concerned about environmental issue and the important impact on health.
This is BBC reporting from ParisWHO 2015. I'm here talking with the United Kingdom. The first question I have for you is, do you have any response to what Germany said to Al Jazeera earlier today?
Yes, I do. Thank you for asking me this. Germany was saying that I was focusing on the resettlement of refugees, and that's not the case. What I meant was, before you can think about educating refugees, you have to provide them with stable living conditions and a safe environment. I didn't mean specifically where that environment was, but just that they need a proper place to live before we can think about talking to them about disease prevention.
Okay, great. And you spoke of refugees. You were the only one in the region that voted against the refugee resolution. Can you talk a little bit about why that is?
Right. So although I recognize that the refugee situation is a crisis, that's exactly what it is, a crisis. So it'll hopefully be over soon, sooner rather than later. And I think for the WHO, our focus is really on health and not the location of people around the world. So as a group, I was hoping that our region could focus more on looking at long-term solutions for healthcare, one of those being long-term care systems for the elderly throughout Europe. A lot of the countries in Europe currently don't have sustainable systems, even though a lot of these countries, a third of their population are now over 65. And we're going to see this more with the low-income and middle-income countries. So I was hoping to focus more on looking at sustainable long-term care systems as a long-term sustainable goal.
Okay, last question. What progress do you hope to make by the end of today?
Well, I hope by the end of today, we can all come to agreement to have a broad and yet specific resolution in its scope. There's a lot of catchphrases being thrown around like e-health and m-health, and I'm not totally sure if everyone understands what those are. So hopefully we can define what that is, and then we can from there say how that can be a tool to improve health throughout the Euro-AMRO region.
Okay, great. Thank you.
Here we are with the Malaysian delegate. So what's the most important topic of ASEAN Group?
We want to empower the healthcare system. We do that in two ways, by education and by the distribution of the finance.
What are the challenges you for region faces?
Well, our region, there are poor countries and also quite developed countries like Malaysia. So we really have to adapt to the poor countries. So, for example, Malaysia has a quite good system, and we have good education. So we face other challenges, and we really have to fight for our cause. Yeah.
Here we are with the Canadian delegate. So, what resolution have you reached in your blog, and how is Canada contributing to it?
Currently, we are debating the use of two resolutions, first being about health infrastructure and the delivery of basic care needs across the American bloc, and secondly, the involvement with Canada has been with the health education paper, which we are talking about unifying and connecting between countries to provide the similar level of care that we've already seen in our own. And this is from birth to death, providing age-appropriate resources that will help guide people in self-management of disease, and also tailoring our work to be with the Merck International Group and also some of the humanitarian aid agencies who are all very supportive of our plan, which is to initiate a unified and cohesive health program that will include refugees and include those that are in less resource supplied areas. And we do this through the use of the internet, but also narrowing the gap between offline and online persons by providing resources for free and also sharing those which we've already developed through the Grand Challenge Canada. And we hope that together with this resolution about health infrastructure, we'll be able to deliver this over the next 10 or so years.
This is BBC. I'm here with Nicaragua. My first question for you is, can you tell us a little bit about the resolutions that you proposed earlier today?
In the AMRO region, we have a lot of different countries, which range from big countries like the USA and Canada, but also smaller Latin countries like Honduras, Nicaragua, Chile, Argentina, and those have very different health needs and factors. After hearing a lot of discussion about what people wanted and what people needed out of their healthcare systems, I thought it would be best to create two resolutions in which focus one on health education and technology, because a lot of countries are very interested in e-technology when it comes to health, and other research and future advancements in technology in regards to health, and others were more interested in infrastructure, a lot of policy making in regards to countries that don't necessarily have the access to technology. So we split them up in two so countries can have a bigger stake and be able to have more of a statement in the field they feel most affects their country.